Hello, my friends, and welcome to the Pathway channel. Today we will discuss the fibroadenoma. And as we know, the fibroadenoma is the most common benign tumor of the female breast, and it happens mostly at younger age, less than 30. The clinical presentation is just a solitary, palpable, firm, mobile mass. Usually it's less than 3 centimeters, and it might be multiple, it might be bilateral or unilateral. Today we will discuss the microscopic features, and the fibroadenoma is well circumscribed and it's unencapsulated lesion, and it's characterized by proliferation of the stromal and also the glandular part of the breast. From this power, we are at the 2.5x. Maybe this is not the best fibroadenoma slide, but I want you to appreciate here the stromal proliferation that we have, all these nodules, and then we have the glandular part, which is forming here a slit-like like shapes. And for this, we can mention that the fibroadenoma can present in two forms, either the intracanalicular pattern or the pericanalicular pattern. The intracanalicular pattern is the one where the stroma will proliferate and it will cause distortion of the gland. As we can see here, like this proliferation of the stroma, it causes this distortion of the glandular part. In the pericanalicular pattern, the stroma will proliferate, but it will surround the glandular structure, which will maintain the open lumen. So this is the low power here, and we will go at a higher power. We can see also from the low power some calcifications, which might happen in fibroadenoma, and that's why it can be detected on mammography as some calcifications, and it may be misdiagnosed as DCIS. But with the biopsy, for sure, we will know that this is a benign lesion. We will go to the high power to see the glandular part and the stromal part, and we'll see if we have any features of malignancy on this slide or not. From this power, we are at the 10x now, and I just want to highlight that the fibroadenomas, they are benign lesions, so we will expect to see benign epithelium or epithelial layer and myoepithelial layer surrounding it. So, and these are all benign cells. We don't expect to find any malignant or atypical cells. Also, the stromal component surrounding it, if we go at a higher power, it's composed of collagen and spindle-shaped cells with ovoid or elongated nuclei. I will try to go on a higher power now, but let's take a look at this power and see if we can find anything interesting. This is the calcification we mentioned on the low power, and these are some stromal cells surrounding it. We will go at a higher power to see the stromal component. So as we mentioned, these are just spindle-shaped cells or collagen with having this elongated nuclei, but we don't expect to see any malignant transformation on this slide. Also for the glandular part, it's expected to see two layers of cells, the luminal cells and the myoepithelial cells, as this is again a benign lesion. I know it's hard to appreciate the two layers on this slide, but at least we cannot appreciate any malignant transformation or any atypical cells. And this is, again, the stromal proliferation surrounding the glands, making it look like this. So in summary, the fibroadenoma is a well-circumscribed lesion. It's a benign lesion. It happens at younger age, less than 30 mostly, and it can be bilateral, unilateral. And the microscopic features its proliferation of both the stromal and the glandular elements. It can present in two patterns, whether the intracanalicular pattern, which we can see on this slide, where the stromal proliferation will distort the glandular element, or it can present as a pericanalicular pattern, where the stromal component will just surround the glandular structure, and the glands will have the open lumina. The patterns, by the way, these two patterns, whether the pericanalicular or the intracanalicular, they don't have any clinical significance. On the high power, we saw the glandular element and we saw the stromal element, and they are both benign. The glandular elements, they are composed of the inner epithelial and outer myoepithelial cells, and the stromal component is just spindle-shaped cells and collagen with elongated nuclei. I hope you enjoyed this video, and if you like the video, please subscribe to the channel. Thank you, and see you next time. Bye.